Born in Columbus, Ohio. I knew when I was 11 years old I'd be a doctor. I knew when I was 12 years old I'd be a surgeon. I was a competitive swimmer. It was near treason when I didn't go to Ohio State, which was 3 miles from where I lived, but instead went to Yale, which was one of the few teams that ever beat Ohio State in swimming. Columbia Medical School in New York. Then 2 years of involuntary servitude, one in Walter Reed and one in Long Binh, Vietnam. Then in '76, I came to Omaha. The big attraction was a chance to make congenital hearts, children's hearts, be the primary thing I did. What I do is fix children's hearts. Lots of things can be wrong with them, and they need fixing. If there's a hole, you close it. If there's an obstruction, you either relieve it or bypass it. If things don't go the right place, you build a culvert that goes where it ought to go.
It was just really kind of the era in which the dedicated cardiac surgeon for pediatric and congenital work was really starting to come into vogue. Bill was really the only and first congenital heart surgeon in Nebraska. He really started the tradition for which we now have outstanding congenital heart surgeons, and they followed in his footsteps.
About 40% of what we did could not have been done 6 or 7 years earlier. We were just always moving ahead.
The patients you took care of were different because some of the sickest patients that they operate on now, they didn't have operations at that time that were appropriate for them. And a lot of the things that are considered commonplace now were the things that they were working on at that time.
Diagnosis back then was primitive. We didn't have any ultrasound. Today's docs can't imagine trying to do anything without ultrasound.
Well, Dr. Fleming had all the key components for developing success of the program. He was a dedicated academic surgeon. Nothing was even second to providing the best patient care. He was passionate about education and research. He presented at national meetings, some innovative things that he took on.
What Dr. Fleming did was provide a great foundation for continued advancement of cardiac care for children in the region.
We came from a very modest situation as far as heart care for children and built it into something that's very good and nationally recognized. Just a matter of trying to do the best thing for the kids and trying to get people who could help do that. For me, and I hope for children's, it was the right thing to do.
Dr. Bill Fleming was a leading force in advancing surgery for congenital heart disorders, forging a new generation of cardiac surgeons and supplying hope for generations of little hearts everywhere.